Hello everyone, we've got a really special video for you today, and it's a detailed cranial nerve exam collab video with some absolutely awesome ASMR artists. Their channels will be linked in the description, so please do check them out and enjoy the video.
Hey, I'm Freya ASMR, and I'm gonna do your olfactory nerve exam today. So we're gonna be testing your ability to smell and to differentiate different smells. I'm gonna make you smell 5 different little smells. So this is gonna be the first smell, and you're just gonna tell me what you can smell. Okay, take a deep breath in for me, and then tell me what you think was in there. Okay. This will be your next smell. Please take a deep breath in again. Yep. And tell me what you think that was. Yeah. Okay, thank you. And here's smell number 3, please. So number 3 is orange, you said. Okay, orange. Thank you. One deep smell again, please. What do you think that smells like? Okay, very good. Okay, thank you so much. And now the last one. Again, another deep breath in, please. And that one was mandarin. Okay. Well, it looks like that your smell is in absolute great condition. You did 10 out of 10 and got everything right. So I think you're all good, and you can go on to my colleague for your next exam.
Hello, I'm Dr. Maria. We're going to be examining your glossopharyngeal nerve today. That is the 9th cranial nerve located in the medulla, and that controls the 1/3 posterior of the tongue, which is your taste and sense, okay? Mainly focusing on taste today. But before we do that, I just want to make sure that your palate is okay before putting any flavored liquid on there. So go ahead and stick your tongue out and give me a big ah. Go ahead. And again. And again. Okay, perfect. Okay, so go ahead and take this drink of water just to cleanse your palate before we put anything on there. You ready to begin? Okay. So I have these 3 tubes here, and you're just gonna tell me what you taste, okay? So let's begin with green. So go ahead and tell me what you taste. Hold out your tongue. Okay. And what do you taste? Sweet. Okay. Perfect. Yep. And the next one is gonna be pink. Okay. And you're just gonna tell me what that tastes like. Go ahead and hold out your tongue. Okay. Spicy. Yep. Perfect. And the last one, orange. Go ahead and hold out your tongue for me. Okay. And what was that one? Sour. Yep, it was. Well, you did perfectly fine. So I'm going to give you to the next doctor.
My name is Dr. Jembro, and I will be performing a cranial nerve exam on you today. My portion of the exam will cover your eyes, mainly because the trochlear nerve has been having some issues, you reported. So we're going to do a quick overview. The tricular nerve handles your eye movement. So I will be performing several different exam techniques to kind of assess that nerve and kind of provide you a plan and move forwards. And as they move around, just watch it and we will assess. Okay? Ready? Here we go. Okay, very good. We're going to do the other side now. Okay, very good. Now one of the final tests that we'll deal with things moving around a little bit here is we're going to test when things kind of get out of your peripheral vision. I'll be moving my fingers like this. When they kind of get out of your peripheral vision, please let me know. Okay, here we go. Perfect. Good. Perfect. Good. Excellent. Excellent. Okay. So those are basically our overall movement test. We will be now, I just want to look at a few different things with you, following the light around that I have here in my little pen light. Please, as I hold up my finger, don't look at the light, but look at my finger as I move it around. Just kind of ignore the light. Alright. Ready? Here we go. Okay. Perfect. Okay, now we're going to do the other side. Just same thing. I'm going to have my finger up and I'm going to be moving around and I'm going to be shining it in with the light in the other eye. Don't look at the light, just continue to look at my finger. Excellent. Okay. Now the final test that which we are going to do here is going to just briefly test your how your eyes react to light and how it moves about. So just kind of continue to stare at my nose. And I'm going to be shining light in a little bit and try not to look directly at the light. Okay. Here we go. Remember, look at my nose. Perfect. Now we're going to do the other eye. Just look directly at my nose. Alright, perfect. Alright, things are looking pretty good. I don't have any more further tests. We will continue on and move on to the next test, and overall, your results from this test will be discussed at the end. Thank you.
Okay, the next part of this exam is the optic part, and it's the visual acuity test. And what the visual acuity test does is it measures the sharpness or keenness of thought, vision, or hearing. All you have to do is identify the letters and shapes that I point to. Are you ready to begin? Okay, let's get started. You're doing great. That's it. You did great. Only a few more exams left, and you'll be ready to go.
Hi, welcome. My name is Dr. Sabrina. How are you? Good, good. I'm glad to hear that. So one of the other doctors will be conducting your cranial nerve exam, okay? Okay. So my part of the examination covers the 8th cranial nerve. That is the auditory vestibular. In simpler terms, that is responsible for our hearing, okay? Okay. So in this examination, I'll be putting certain items next to both of your ears. And all you have to do is let me know if you hear them, okay? Yes, it's really easy. Okay? So just let me know if you hear them. And just try to relax, 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 okay? Are you ready? Okay, let's get started. Okay, so I'm gonna start with the first item, okay? Can you hear that? You can? On both sides? Okay, great. So I'm going to go in with the second item. What about that one? You can? Both ears? Okay, great. Okay, so I have one more item. Okay, are you ready? Are you able to hear that one? Yes? Okay, great. Alright, so it looks like you passed this part of the examination. I'm gonna send you up to the other doctor now, okay? Thank you so much for coming. You take care. Okay, bye-bye.
Hi, I'm going to be evaluating your 8th cranial nerve. That's your vestibular or cochlear. Vestibular meaning balance and eye movement, and cochlear meaning hearing. Let's begin. I'm going to repeat a word 3 times, and I'd like you to repeat it back to me. Can you hear me? Sk, sk, sk. Yes, alright, let's begin. Atomic, atomic, atomic. Stipple, stipple, stipple. Octopus, octopus, octopus. Cockapoo, next part of the evaluation is your vestibular. I want you to hold your head still to one side, and I'm going to be moving this around, and I want your eyes to follow it, but your head to stay very still. All right, ready? Good. Now turn your head to the other side. Ready? You did excellent. You passed all of the evaluation. Your 8th cranial nerve looks healthy. Thank you so much. I do want to say, you've been really a delight, and don't tell any of the other patients, but you're my favorite one. All right, good luck with the rest of your evaluations. Have a great rest of your day.
Okay, so as part of your really detailed cranial nerve exam, it's always a good idea to check your heart and lungs to see how they're functioning. So the first thing I'm going to do is measure your blood pressure. Can you just stretch an arm out for me, please? I can put the cuff on. Okay, the cuff will begin to go tight. Just try to relax as much as you can. Your blood pressure reads 120/85, so that seems to be okay. I'm just going to take a look at your pulse and your oxygen levels. Can I just take your index finger, please? Just take a minute to read what that is. 98 and 92. Your pulse is a little bit high, but it could just be if you're feeling a little bit nervous because you're at the doctor's, so I'm not too concerned about it. It is below 100. And lastly, I'm going to first take a listen to your heart, okay? I apologise if my stethoscope is a little bit cold. I will try to be quick. Just breathe normally and try to relax. Okay. Your heart sounds absolutely wonderful. I can't hear any murmurs there or anything at all. That is concerning. I'm going to take a listen to your lungs now. Start off with your left lung. Take a really big deep breath in. Hold it. And exhale. Okay. Now onto your right lung. Deep breath in. Hold it. And exhale. Okay, I'm just going to check from the back. Deep breath in. And exhale. The other side. Deep breath in. And exhale. The lungs sound clear. There's no evidence of any crackles that I could hear. So I'm going to send you on to the next doctor.
Oh, great. You're awake. Oh, I hope I didn't scare you. Yeah, I'm Nurse Moon. I think the last doctor just overstimulated you a little bit and you passed out. Do you not remember any of that? Okay, that's fine. That's completely normal. Oh, okay. It's coming back now? Yeah, I know. It's a little frightening when that happens, but like I said, everything's fine. I'm sure you remember what we were speaking about before you did pass out. I'm just here to test your hand strength. So I'm gonna have 4 items that I need you to repeat the same motions as me and let me know if there's any discomfort. Does that sound like something that you can do for me? Okay, sweetie, let's just get started. So the first item I have is this little squish. And it's not hard at all to just compress that down. You can see it. So that's all that I need you to do. I just need you to squish on it. Okay? Here you go. There you go. There you go. Any discomfort? Okay, good. Let's move on to the next one. So, I have this little big stress ball. Isn't he so cute? So you can see he's got a little nose, and I just need you to press on his nose. Okay? Can you do that for me? Just press on it just with your pointer finger. There you go. Okay, yeah, press on the nose. There. Okay, now your other finger. Good. No discomfort? Okay, everything looks good. Okay, and then the next item that we have is this ball here. As you can see, it has 2 holes. I need you to take your pointer fingers and stick them inside. Your other 3 fingers are going to go above, and then you're just going to push down. Okay, can you do that for me 5 times? Go. Okay, 1, 2, 3, 4, and 5. Any fatigue at all? No? Okay. Okay, and then the last thing we have is just this very firm ball right here. Okay, I just want you to squeeze it and pass it back and forth. Okay, sound good? This is it. This is the last one. There you go. Okay, good. Everything seems to be fine, so if you're not having any discomfort, I think it's okay to send you off to the next doctor. Yeah, no problem. Okay, let's go.
Hello, I'm Dr. Maple, and I'm about to perform a very simple cranial nerve exam. I'm going to be examining your 11th cranial nerve, also known as the accessory nerve. This nerve controls 4 muscles, or 2 pairs of 2 muscles. The first muscle it controls, in no particular order, is your sternocleidomastoid, or sternocleidomouthful, as I prefer. It connects your sternum to your clavicle or collarbone, all the way up your neck to your mastoid, which is just below your ear. These 2 muscles allow you to swivel your neck left and right, as well as nod forward and back. The other muscles that the accessory nerve controls are your trapezius muscles, which are 2 very large triangular muscles on your back. Those 2 muscles control your shoulder blades. Now there is a very simple test for both. I am going to put my hands on your shoulders and push down, and I want you to push back. This tests your ability, or your nerve's ability, to function. I don't know how else to put it. So I need you to pretty much shrug, and I'm going to push down, okay? Okay. 1, 2, 3. And that's perfectly fine. No problems there. Alright, to test your sternocleidomastoid, I need to put one hand on your chin and another on the back of your head. And I'm going to try to turn your head first left and then right. And then you need to push back, just like with the shoulders. Alright? Alright. So first, left. And ready? Alright. 1, 2, 3. Perfect. And now right. 1, 2, 3. Wonderful. Everything seems to be functioning properly.
Hello, and thank you for taking this portion of the cranial nerve exam over the phone. I'll be conducting a brief emotional well-being check today. There are no wrong answers, and none of these questions are meant to make you uncomfortable in any way. Please be honest with your answers, but if you do not feel comfortable, then we can skip that question. Let's begin. How are you feeling today? Have there been any recent significant changes in your life? If yes, how has that affected you emotionally? How many times per week are your activities affected by negative emotions? Of these times, how many would you consider are lower intensity negative emotions? What about higher intensity negative emotions? Have you, in the past week, had to cancel plans due to these emotions? Have you, in the past month, had to cancel plans due to these emotions?